Israel now has started giving third vaccine booster shots to some immunocompromised, high-risk individuals. It's a big decision. As you know, the FDA from America, the CDC, they say booster shots are not necessary at this time. The science does not justify it. Why does Israel feel differently?
Well, this concerns mainly patients who have not developed probably their immune system is compromised, and thus we need to give them a boost, actually maybe to re-immunize them in order to get them immunized. We have seen that some of these, for instance, people who have had organ transplants, they don't develop as well the antibodies to the virus as well as other communities. And it was shown that if you immunize them with a booster, they might actually develop a better immune system towards the virus. So for these groups who have basically hematological ailments, people who have had organ transplants, and some others who who have received in the past some medications that prevent them from developing the immune response necessary for COVID, these guys are going to get a booster and maybe two boosters in order to get their immune system fight COVID. So this is the group that is currently being looked at, and we are going to give them a third and maybe in the future a fourth booster. So it's.
Can I ask, Doctor? You mentioned, I want to ask about what Dr. Fauci from America said. That he certainly thinks a third booster shot may be necessary at some time, but the data isn't there yet to show it will actually boost antibodies or the serological response. You mentioned the word it might help. I mean, is there evidence that it will?
Well, there is indirect evidence because we have seen that those who actually receive the third booster, they develop high titers of antibodies, and that has been shown by Pfizer, was looked into that. So we are pretty sure that giving another dose will enhance the ability to fight COVID. Whether this is good for the whole population, that's still debatable, and we don't think that this is at this point the right strategy for the whole population. It may be helpful to those who need it, who don't have a good immune response towards the virus, and we'll see. There is not much to lose because if you save a life in the low cost of one shot, basically it's worthwhile.
Doctor, another question I have for you, sir, about another bold decision, the recommendation that some kids, that they're high risk or they live in a high risk household, some kids that are under 12 should get the COVID vaccine. As you know also, Pfizer is still testing out the efficacy and the safety. The FDA is not recommending that. Is it a sensible, responsible thing to do to give, little kids the vaccine at this time?
Well, if we wouldn't think so, we wouldn't have decided this decision. It concerns only those kids who have severe underlying diseases and which put them in jeopardy and in danger if they meet COVID. And now that we have a surging Delta variant in Israel, we do think that giving these guys the immunization will actually enhance their ability to fight COVID if they encounter it. So it's only for a very limited group. Every case is dealt individually. So it's not a decision about a population. It's an individual decision concerning those kids. We've done it before in the ages of 12 to 15. It's worked well. And hopefully in a very short time, we'll get the answers from the clinical trials that Pfizer is conducting concerning the safety, and we do have the belief that the safety will not be much different than for the other age groups. So we do think that the benefits of this move are outgrow the risks.
So we're all,
definitely.
Doctor, we're almost out of time. I just want to ask quickly, sir, your thoughts. Is it safe in next school year to have full in-person regular classes among kids too young to be vaccinated?
Well, it's difficult to say. My personal feeling is that it might be, definitely, that the studies will be conducted in a usual manner, and we do hope that it will prove the right way.